So, a new article came out about the role of diaphragmatic breathing and urinary incontinence, and this came out in January 2022 in one of my favorite journals, the Journal of Bodywork and Movement Therapies. And let's go through this. So, this is a pilot study, which pilot studies are not the top of the food chain, but this is where stuff starts, and oftentimes there's some really good gems and nuggets in here of information. So, let's go through this. So if you look at the top here, the goal of this particular research study was to look at the effect of diaphragmatic breathing and this particular exercise on urinary continence treatment. And then the other purpose was to compare the effect of pelvic floor exercises and diaphragmatic breathing exercises on urinary incontinence. So they randomized the people into two groups, 20 in each. The exercise protocol consisted of one set of contractions per day, and each set included 30 repetitions. They did this for 6 weeks. And the women's were asked to fill out these different indexes and questionnaires to help give an objective measure for what they asked. So the results that they found was that both groups had significant improvement after the exercises, and there were really no difference between the groups in the post-exercise scores. One of the indexes that they used is one of the most commonly used when we talk about urinary incontinence, which is UDI-6, which is specific, but it is not necessarily sensitive. So if this UDI-6 score actually shows a change, if it does show a change, it will absolutely be statistically significant. It really is hard to show change with that. So that's actually showing that that's pretty awesome. So their conclusion is diaphragmatic breathing exercises may be an alternative to pelvic floor muscle exercises in the treatment of urinary incontinence. Now, let me tell you a story about why I think this is awesome. So the other day I was working with a patient and I was teaching them my diastasis recti protocol. We were working on strengthening the pelvic floor, working on breathing, dropping the ribs, engaging the pelvic floor, all these things. And oftentimes when I go to teach people diaphragmatic breathing, they are not the best. They are not the best. And this woman, rock star status. Never have I ever taught a person and they were magic. They were perfect. So then when I went to have her do her pelvic floor and TA stuff, she said, oh, that's basically what I do at the very end of my diaphragmatic breathing to get the last bit of air out. So she was glorious with her diaphragmatic breathing. And so therefore, when I started her on this protocol, she was exponentially better and faster and further along because she was a secret diehard yogi who already practiced breathing daily. She just needed some more actual gross motor strengthening. And this is the research to prove why. Pretty cool.